makadungog na mo.
Yes, ma'am.
Yang makadungog na mo gang. Sorry kay ang connection nila yun kadayo.
Ga-echo sa ako part na.
Ka-echo ko.
Yes, ma'am.
Sige. Ito ang cellphone. Sige. So what is antibiotic? Ano lang. So, antibiotic. The class of antibiotics are the following: carbapenem antibiotic, cephalosporin antibiotic, penicillin antibiotic, and beta-lactamase inhibitors. Glycopeptide antibiotic, aminoglycosides antibiotic, lincomycin antibiotic, fluoroquinolone antibiotic. So, what is antibiotic? So, antibiotic is a medicines that fight infections caused by bacteria in humans and animals by either killing the bacteria or making it difficult for the bacteria to grow and multiply. So, there are two main types of antibiotic, guys, ha. It is antibactericidal and bacteriostatic. So there are two main type of antibiotics which work in their unique ways. So the first one is bactericidal antibiotic, which means it kills the bacteria. And then number two, bacteriostatic antibiotic, which suppress the growth of bacteria, prevent the growth of bacteria. Guys, madungog na ko ninyo. Hello?
Yes, ma'am.
Okay na? Okay na? Masensya kayo ha. Sige. Kung ano ba mo kung madungog ha. So look at the pictures or the image gang at the left side. So there is no antibiotics. So the bacteria can multiply. So if we will use antibiotics, either bactericidal or bacteriostatic, so look at the picture at the center. So the bacteriostatic antibiotics prevent the bacteria from multiplying, and then the other one, it kills the bacteria. So bactericidal antibiotics, there are groups of bactericidal antibiotics. Look at the slide 2. So, bactericidal antibiotics, remember, of the mnemonics BANG, Q, RIP. These are the examples of antibactericidal antibiotics. The beta-lactams, aminoglycosides, nitroimidazoles, glycopeptides, quinolones, rifampicin, polymyxins, ano na siya, back. So, 1, 2, 3, 4, 5, 6, 7. 7 are the examples of bactericidal antibiotics. So, in our pharmacy, we have unsa man ang antibiotics na naa nato under
Rifampicin.
bactericidal. Okay, beta-lactams. Okay. What else gang? Kanang aminoglycosides, glycopeptides, quinolone, rifampicin. Ang polymyxins, wala man siguro no. Polymyxins BDI katong antifungal. So let's proceed. Other bacteriostatic antibiotics are the following. Remember the mnemonics: sneeze, cold. Macrolides, sulfonamides, chloramphenicol, oxalidinones, then cosamides, and tetracycline. So, ang example nga naa nato sa pharmacy are unsa? Macrolides, linfosamides, tetracyclines. So, what do antibiotics treat? Antibiotics cannot treat viral infections such as common head cold, runny nose, cough, sore throat, sinusitis, ear infections in children, vomiting, and diarrhea. Antibiotics only can treat contained infections caused by bacteria such as urine, kidney infections, persisting cough, cough in people with chest problems, high fever or very unwell, skin infection, example cellulitis or meningitis. So antibiotics are also needed to treat life-threatening conditions caused by bacteria such as sepsis. So look at this image again. Sepsis. So what is sepsis? So sepsis, it is the body's extreme response to an infection. Diba, since nakakuyog naman mo na mo sa AMS, no, word round, so you have any idea about sepsis na, no? Balo na mo gang. So sepsis, it happens when an infection you already have triggers as a chain reaction throughout your body. So it is also an infections that lead most often to the asaman sa lungs, sa urinary tract, skin, or gastrointestinal tract. So lantawa ang pictures. These are the common sources of sepsis. So asaman ang sepsis, either sa brain, meningitis. So, infection of a known, hindi maklaro lagi ni gang. And then pneumonia sa lungs. Then sa skin or soft tissue na nasa urinary tract. And then nasa abdominal. Ano siya usually common nga ang sepsis. So when it comes to sepsis, remember again the mnemonic. Remember, it's about time. So what is time? Watch for what is the IMI? So T is for temperature. So if the patient is ill, so you have to consider the temperature. Yun sa klaseng infection, mental decline, if confused ba siya, sleepy, or difficult to rouse. And then, extremely ill, with severe pain, siya discomfort, or shortness of breath. So, time, ang temperature, if higher ba or lower than the normal. And then, kung infection, if na ba siya signs and symptoms. So, some facts on antibiotics. So, wala naman mani, discuss naman yun din ninyo, no? So, si Alexander Fleming discovered the penicillin, which is the first natural antibiotic in 1928. So, antibiotics cannot saman fight viral infections, ha? Hindi na siya makahelp sa viral infections. Antibiotics either kill or slow the growth of bacteria. So common side effects can include diarrhea, upset stomach, and nausea. So there are various classes of groups of antibiotics which depend on their chemical structures. Some classes antibiotics belong to cabinet 6. So antibiotics are powerful medications that treat and contain infections and can save lives when used it properly, ha. So mani siya. So so first class of antibiotics is, this is an example of restricted antibiotic, ha, na naa sa ato ang pharmacy. First, we'll discuss about carbapenem antibiotic. It displays a broad spectrum activity covering gram-positive, gram-negative, and anaerobic bacteria. They are useful for treatment of a wide variety of moderate and severe infections, including bacteremia, hospital-acquired pneumonia, intra-abdominal infections, and obstetric and gynecologic infections. So, the examples or under the carbapenem antibiotics are the following. Na naana sa atong pharmacy ha. Meropenem, ertapenem, and imipenem. Who can give me some example of meropenem gum?
Mero,
Mer
Who?
Meromax,
Wow, sige. Meromax. And then how about erta? Ertapenem. O sige. Ertapenem is, ito na dito, okay? Sianam. And imipenem is, I know, invans ang ertapenem eh. Imipenem is niyanam. So look at the picture. Example of meropenem. Rovipen, 1 gram, Dionatronem 1 gram, Meromax 1 gram, and 500. The available brands are the following. Mero 500, Mero 1 gram, Meronem 500, Meronem 1 gram, Groovy Pen 1 gram, Meromax 500 and 1 gram, and then Natronem. So pharmaceutical form of meropenem. It is a powder for solution, for injection, or infusion. A white to pale yellow crystalline powder. The pH of the product after reconstitution is 7.3 to 8.3. So the therapeutic indications. It is indicated for the treatment of the following infections in adults and children. So severe pneumonia, including hospital and VAP, ventilator-associated pneumonia, so bronchopulmonary infections in cystic fibrosis, complicated urinary tract infections, intra- and postpartum infections, complicated skin and soft tissue infections, acute bacterial meningitis. Well tolerated with the most common adverse effects being diarrhea, rash, nausea, vomiting, and inflammation of the injection site. So the stability of meropenem after reconstitution. So intravenous bolus injection administration dissolve in sterile water for injection up to 3 hours at controlled room temperature. 15 to 25 degrees Celsius or up to 8 hours under refrigerated conditions 2 to 8. Intravenous infusion administration for dissolve either certified nitrogen chloride solution 6 hours at controlled room temp or up to 12 hours under refrigerated conditions. It stored under refrigerators should be used within 1 hour after it has left the refrigerator. There are 5% dextrose solution should be used immediately. Example, with 30 minutes following reconstitutions. So, ang number 2 is ertapenem. So, Invance ang brand name na to available sa pharmacy. It is a powder for concentrate, for solution, for infusion. It is a white powder. Therapeutic indication, it is a broad-spectrum carbapenem antibacterial agent with a narrower spectrum of activity that can be given once daily by infusion. Has used to treat skin and soft tissue infections, intra-abdominal and pelvic infections, and diabetic foot ulcer, infections caused by polymicrobial infections or extended spectrum beta-lactamase or ESBL producing coliforms. Common adverse effects include diarrhea, nausea, vomiting, headache, infusion site complications, and altered mental status. Seizures have been reported in some patients. indicated in pediatric patients and in adults for the treatment of the following infections when caused by bacteria known or very likely to be susceptible to ertapenem and MNMAT. Parenteral therapy is required. So it is an intra-abdominal infection, acute gynecological infection, diabetic foot infections of the skin, and soft tissue. So, makabantay mo guys nga, most common sa mga infections, almost the same ra ang treatment, that it depends on the etiologic agents pud siya sa bacteria. So the stability for ertapenem, diluted solution should be used immediately. So the next third one is imipenem cilastamin. This is a available brand for imipenem is Yana 500 milligram vial. So isa rin ni ka-brand nga available na to sa pharmacy, kani nga brand. So, a therapeutic form, it is a dry powder for intravenous infusion, white powder. The therapeutic indication, it is a carbapenem, again, antibiotic with a broader antimicrobial spectrum and greater potency than other beta-lactam antibiotics. Most common adverse effects gapon include infusion-related effects, medyo mag-swell gamay sa area, like gastrointestinal disturbances and rash. Central nervous system-related adverse effects, including seizures, have occurred, especially at higher doses. It is also indicated for the treatment of the following infections due to susceptible organisms: intra-abdominal infections, lower respiratory tract infections, gynecological infections, bone and joint infections, and skin and soft tissues. So the stability for Janam or itapenacilstamine. Diluted solutions maintain its satisfactory potency for 4 hours at room temperature or for 24 hours under refrigerator. So let's go to the second class of group of antibiotic. So this is cephalosporin antibiotics. So cephalosporin antibiotics belongs to unsa siya gang? Restricted, monitored, or permitted? Hello? Hello guys?
Permitted pa.
Okay, matungog ako din yun. Permitted siya. I think na siya na belong sa monitored. Sa mga cephalosporin, pwede po siya, pwede po din siya sa permitted. But not restricted. So, cephalosporin antibiotics are a type of antibiotic that can treat range of simple infections, especially for people who are allergic to penicillin, are a type of beta-lactam antibiotics. Some examples of infections that cephalosporin can treat include skin and soft tissue infections, UTIs, strep throat, ear infections, pneumonia, sinus infections, meningitis, and gonorrhea. So under cephalosporin, antibiotics are the following: cefepime, ceftriaxone, and ceftazidime. Wait, so cefepime, ano siya under be? Ayaw ka, under siya sa restricted ha, ayaw kalimot, restricted. How about ceftriaxone? Pwede siya sa monitored. Okay. And ceftazidime under pwede siya sa under dito siya sa monitored food gum. So these are the example of cephalosporin. Cefepime. First is cefepime. So the brand are following: Cefevex, 1 gram vial. Axera, 500 milligram, 1 gram, and 2 grams. So pharmaceutical form is a dry powder for intravenous injection. Solution, white to pale yellow powder. Therapeutic indication. It is a fourth generation cephalosporin antibiotics. It has an extended spectrum of activity against gram-positive and gram-negative bacteria, with greater activity against both types of organisms than third generation agents. So this is a fourth generation cephalosporin. It is indicated for the treatment of pneumonia caused by susceptible bacteria and for empiric therapy for febrile neurotrophic patients. It is also indicated for the treatment of uncomplicated and complicated urinary tract infection, including pyelonephritis, uncomplicated skin structure infections, and complicated intra-abdominal infections. Ano ni? Used in combination with metronidazole. Madungog na ko ninyo? Kay marag na ay nitin. Stability after reconstitution. So, store at or below negative 20 degrees Celsius. Though frozen container under refrigeration with 5 degrees Celsius, do not force thaw by immersion in water baths or by microwave irradiation. The thawed solution remains stable for 7 days under refrigerator 5 degrees Celsius. Then do not refreeze. Ano yun? Common brand sa ceftriaxone. May palaghan tayo. Triaxone. Ceftriaxone 1 gram vial. Ceftri 1 gram vial. Triaxone 1 gram. Eftrix 1 gram. 4 gram 1 gram. Caprix 1 gram. Rosifin 1 gram. Sorry guys ha, Tantric 1 gram. So Ceftrax is combination with Nesha with beta-lactams. So sa ceftriaxone, the pharmaceutical form, it is a dry powder for solution for intravenous injection or infusion. Ang color sa powder is white to pale yellow. Ang iyang therapeutic indication, belong siya sa third generation of cephalosporins. Almost the same ang iyang therapeutic indication sa uban nga cephalosporin antibiotics gang ha makatreat pud siya sa mga gonorrhea, pelvic inflammatory disease, sa meningitis, infection sa lungs, sa UTI, sa bones, joints, and abdomen. It is also sometimes given before certain types of surgery. Unsa gani pag anagam if the antibiotic is given before the surgery? Muna siya tawagam. It is a prophylaxis. So, prophylaxis antibiotics. So, once or good na siya ihatag. It is also indicated for lower respiratory tract, skin and skin structure infections. Almost the same ra siya sa therapeutic indication sa uban nga mga kinds of antibiotic, but muto ako ngingon nga it also depends on the etiologic agent sa bacteria nga din unsa na ba siya ka worse sa ihang infection. Thus, the stability after reconstitutions, stable for 6 hours, and then at 25 degrees, and for 24 hours at 2 to 8 degrees Celsius. Next, another example of cephalosporin, si ceftazidime. Examples of ceftazidime are the following. Ceftan 1 gram, Fortum 1 gram, Napoy Fortum 2 grams, Acefex na 1 gram, Ceftriaxone 1 gram, and 500. So indication, pharmaceutical form sa ceftazidime in general. It is a powder for solution for injection or infusion. It is a white to cream colored crystalline powder. 'Di ba makabantay man mo every time. I know if mag-dispense mo og antibiotic, mag-open ba mo sa box? Gang? Hello? Mag-open mo? Nakabantay na mo sa ilahang mga color sa powders?
Wala mi naka-try. Wala ko ka-try.
Kinsa ba tong gabi nga kay pa-checking gani, 'di ba every time mag-checking ta, ang pharmacist mag-checking kay open gid ang box. Nung nang makabantay mo nga lahi-lahi gid ang color gid mismo literally sa powder. If ever ba mag-wonder mo, pwede na mo mulanta unya. Ay mo to ako ngayon na naay usay white ra ang color, na po isay pale ang color, di na po isay nga marag yellowish ang color, especially sa mga na vials nga clear lang siya. Kung makita yun din yung difference sa ilahang powder. So that proceed ta. So therapeutic indication is also a third generation cephalosporin. It is also used to treat bacterial infection in many different parts of the body and also works by killing bacteria or preventing their growth. Indicated for the treatment of infections in adults, children, including neonates, nosocomial pneumonia, bronchopulmonary infections in cystic fibrosis, bacterial meningitis, chronic suppurative otitis media, malignant otitis externa, peritonitis. Used in perioperative prophylaxis of urinary tract infections for patients undergoing transurinary res- res- ah, resection of the prostate. So the stability for ceftazidime, stable for 2 hours, 8 hours at 25 degrees and 24 hours at 4 degrees. So next, let's proceed to the next kind or sa class of antibiotic. So the third part na ta sa third class or group of antibiotic, which is penicillin, antibiotic, and beta-lactamase inhibitors. So it is used to treat ear infections, sinus infections, urinary tract infections, lower respiratory infections, and pneumonia. Penicillin also works by preventing the growth of the bacteria. And the beta-lactamase inhibitor protects the antibiotic from the bacteria, increasing the effectiveness. So the examples of penicillin antibiotic and beta-lactamase inhibitors includes piperacillin tazobactam and ampicillin sulbactam. So, what kind of antibiotics ning kaan piperacillin? Asa siya mabilong? Sa bactericidal or sa bacteriostatic? In idea, guys. Sige, so, belong siya sa bactericidal antibiotic. So, ang example sa piperacillin tazobactam. So, daghan kayo, no? This is also antibiotics that belong to restricted. Amraceta 4.5, Pentazo 2.25, and 145, Piptas 2.25 and 4.5, Tazocin 2.25 and 4.5, Tazocure 0.45, Tazogate 4.5, Tazovix 2.25 and 4.5, Rabactam 4.5, Vigosi 2.25 and 4.5. So therapeutical form. Powder for solution for infusion, it is a white to off-white powder. So Therapeutic indication, indicated for the treatment of the following infections in adults and children over 2 years of age. Severe pneumonia, including HAP and VAP. Unsa ganining HAP and VAP gang? Nay makaguess unsa ni? Ha? Nay makaguess? Sige. So, VAP is hospital-acquired pneumonia and VAP is ventilator associated pneumonia. Complicated urinary tract infections, including pyelonephritis, complicated skin and soft tissue infections, including diabetic foot infections, used in the management of neurogenic patients with fever suspected to be due to bacterial infection. The stability for piperazine and tazobactam, stable for 5 hours at 20 to 25 degrees and 24 hours to 2 to 8 degrees. Next is ampicillin sulbactam. So, Hello? Makadungog na mo na ako. Wala. Wait sa. Hello?
Good morning,
Madungog na ma'am.
Ay,
Good
good
morning.
morning. Sorry, good kaayuhan. Nakadungog na mo. Atong ako ang na-discuss. Marag, asa na to dapit. Kaya wala ko kabantay nga. Ga-report ko na ano na di ito, na-add na ang link ba. Asa na mo dapit gang? Asa ko dapit na?
Ito, Celine Sulbakta, ma'am. Katong pictures lang pa.
Taon-taon na di. Katong ni N, gayaw-yaw ra di ay ko ning wala na di ay mo. So wala kaning sa van kumaisin, wala pa mo ani.
Wala pa ma'am.
Wala.
Hala, nalingaw ko. Kani.
Sa ampicillin, ma'am.
Kani. Kani gang. So sa ampicillin, hala pasaylo ah. Mao ni no?
Yes ma'am.
Sige, sige. Na pasaylo agid kaayo. Okay. Okay.
Tana, ma'am.
Kana no? Na. So mo ni siya ang example of ampicillin sulbactam sa badaghan kaayo no. Familiar naman good pud mo ani nga mga brands no. So, Ampimax 750 and 1 gram. Amsulvac 750 and 1 gram. Siltavin 750 and 1 gram. Cilium 750 and 1.5 grams. Unison 750 and 1.5 grams. So, the therapeutic form. It is a powder for solution, for injection, white to off-white, and crystalline powder. Ang therapeutic indication is indicated for bacterial septicemia, bone and joint infections, gynecological infections, intra-abdominal infections, lower respiratory tract infections, skin and skin structure infections, UTI, uses as prophylaxis for surgical infections, and the stability for reconstitutions. It is stable for 8 hours at 25 degrees Celsius or 48 hours at 4 degrees Celsius. And then we will proceed to another class of or group of antibiotic, which is glycopeptide antibiotic. So, ini idea asa mabilang si glycopeptide antibiotic? Asa sa bactericidal or bacteriostatic? Ha? Bacter. So, si glycopeptide belong to bactericidal siya. It kills the bacteria. So, antibiotic that inhibits bacterial cell wall formation by inhibiting peptoglycan synthesis. They are used for the treating multi-resistant Staphylococcus aureus infection and intracoccal infections, which are resistant to beta-lactams and other antibiotics. So, the example of glycopeptide is vancomycin. So, vancomycin is an example of restrict. Sorry. Sorry, guys. Under restricted antibiotic. So, there are example of the brands of vancomycin. MRSA 500 and 1 gram vancomycin. Catorination generic Hospira 500 milligram. MRSA 500 milligram. Then apoy kuan gang. Ay kuan na ini vancoblis na ini nagbalik ako MRSA vancoblis na siya. So the pharmaceutical form of vancomycin. It is a powder for solution for infusion. Color of white lyophilized plug when reconstituted with water, it forms a clear solution. So the therapeutic indications, it is indicated in all age groups for the treatment of the following infections: complicated skin and soft tissue infections, bone and joint infections, CAP. Balumon sa na CAP, no? Community acquired pneumonia. HAP is hospital acquired pneumonia and including VAP, ventilated associated pneumonia. Effective endocarditis, indicated for the perioperative bacterial prophylaxis in patients that are at high risk of developing bacterial endocarditis when undergoing major surgical procedures. So the stability after reconstitution for vancomycin is maybe stored in the refrigerator 2 to 8 degrees for 24 hours. Ayaw, kanina akong gamit kay mukuan siya. Scattered siya. And then the other class of antibiotics is aminoglycoside antibiotics. Kinsa may makagive og example of aminoglycoside antibiotics, guys? Sorry. Anybody gang kinsay maka-give example sa brand or generic sa aminoglycoside antibiotic?
Amikasi.
Oh, very good kayo. So, aside. This is a class of antibiotics used mainly in the treatment of aerobic gram-negative bacilli infections, although they are also effective against other bacterial, including Staphylococci and Mycobacterium tuberculosis. It does work by inhibiting protein synthesis inside bacteria, and most common side effects of this drug are impairment of kidney function and hearing loss. Mga example, amikacin. Brand is amikacide, 100 milligrams, sorry. 100 milligrams, 250 milligrams, and 500 milligrams. The pharmaceutical form for aminoglycoside or amikacide, it is a solution for injection containing a clear colorless to pale yellow solution. So, ampule naman siya. Liquid. Therapeutic indication indicated for the treatment of the following infections caused by susceptible microorganism. Sorry. Bacterial septicemia, including neonatal. Most common for the treatment of neonatal sepsis, kundi siya sa mga bata, abantay mo mga newborn babies. Magamit yun aning amikacide. Respiratory tract infections, infections and of the bones and joints, intra-abdominal infections, burns, and post-operative infections. Initial therapy for in suspected gram-negative infection. So the stability for amikacide is stable for 24 hours at room temperature. So the next is lincomycin. So lincomycin belongs to what kinds of antibiotics? It is a bacteriostatic antibiotic. It is an antibiotic classified as a member of a lincosamide class, which typically features L-proline amino acid derivative linked through amide group with an 8-carbon amino sugar indicated for the treatment of what? Serious bacterial infections by susceptible strain of streptococci, pneumococci, and staphylococci in patients who are allergic to penicillins or for situations in which penicillin is deemed inappropriate. So the example of lincosamide antibiotic is clindamycin. So there are the brands of clindamycin. Clindal 300 milligrams, Clindal 600, ang saninaan na to again. Dalamycin 600, then napod tayo. Dalacin 600, Corsin 300 and 600. So the pharmaceutical form for clindamycin, it is ampule gyapon ni siya, solution for injection or infusion. It is clear, colorless solution. The therapeutic indication, it is indicated for serious infections. Sorry, excuse me. By susceptible gram-positive organisms, Staphylococci or Streptococci and pneumococci. It is also indicated for the treatment of severe infections caused by susceptible anaerobic pathogens. The stability for clindamycin, stable for 24 hours at 25 degrees Celsius. So for fluoroquinolone antibiotics, this is a type of antibiotic that kill or inhibit the growth of bacteria. They are important for treating certain bacterial infections, some of which may be serious or life-threatening. So the example for fluoroquinolone antibiotic are ciprofloxacin and levofloxacin. The example brands for ciprofloxacin, Ciprobay 1 gram, 200 and 400 gram vial. Ceroc, Baxolin, Ceprogen. So the pharmaceutical form, so powder na siya ha, vial. It is a faint to light yellow crystalline powder. Indicated, it is a third generation fluoroquinolone used to treat various susceptible bacterial infections. It is indicated for the treatment of skin-to-skin structure infections, bone and joint infections, nosocomial pneumonia, febrile neutropenia, lower respiratory tract infection. Kaya stability, stable up to 14 days at refrigerated or room temperature storage. So next example for fluoroquinolone is levofloxacin. The brands are Floxel 500, Levox 500 milligram vial. It is the pharmaceutical form. It is a light white or yellow-white crystal to crystalline powder. It is a third generation fluoroquinolone. It is used to treat bacterial infections in many different parts of the body, including acute bacterial sinusitis, acute bacterial exacerbations of chronic bronchitis, nosocomial or community-acquired pneumonia, UTIs, acute pyelonephritis, chronic bacterial prostatitis, skin and skin structure infections. So the stability for reconstitutions of levofloxacin is stable for 72 hours when stored at or below 25 degrees and for 14 days when stored under refrigeration at 5 degrees in plastic intravenous container. So, muna dito last part sa ako ang report. So, antibiotics are truly miracle. drug that have saved countless millions of lives. But antibiotics resistance is a critical public health issue that is eroding an effectiveness of antibiotics and may affect the health of each and every one of us. So healthy people eating healthy food should never need to take an antibiotic. So thank you. Guys, nakasabot na mo sa akong report. Hello?
Yes, ma'am. Thank you, ma'am.
Nakasabot na mo? Do you have any questions, gang? Sorry, good kaayo, gang. Kay ang signal, then ang kuan diri sa among agyo, daghang langas. I hope nga nakasabot mo na mo yung mga questions. Ay, by the way, ay guys, kato ganing test, gani sa lab test nga mo detect sa if we need an antibiotic or the patient needs antibiotic. Unsa ganito nga test? Anybody? Nakainomdom mo? Unsa to nga test? Lab test? Nay, maka-recall ninyo? Or naagang wala? Hello?
Ito lang culture sensitive, ma'am.
Ah, culture and sensi. So, under na siya sa, unsa na siya? Si culture and sensi. Kanang ang culture and sensi is mo na siya mo detect if kuan if si patient sensitive to antibiotics or he or she is resistant to that kind of antibiotic. So one of the kuan po na siya test nga need to patient but medyo kuan magud siya. Usually ginahimo ra na siya nga test if admitted si patient or ill na si patient, no? But kung OPD lang siya, wala kayo na siya gi-recognize kay medyo mahal, pricey magud siya pag magpa-test ana man niya. Moran pa siya mga 3 to 5 days. So, muna, muna siya usa sa mga test nga gihimo. So, mo get na siya og sample which part sa body mag-get sa sila example either sa sputum ba or sa mucus ingon na. So i-culture and sensi na siya sa lab for 3 to 5 days. So ang result man na makita after final is 5 days. So makita ni doctor if si patient is need ba siya mo downgrade or mo upgrade sa antibiotic. So kinsay naka kita niyo example sa culture and sensi result gang. Naraman mo yung idea ano, no? Kay katong sa mga AMS rounds na to. And then, ang isa pod is, before ta mo give ni patient of antibiotic, unsay kinahanglan nga test. So, procalcitonin. So, procalcitonin mo na siya mo detect if the patient needs antibiotics. So, na po na siya range dito less less than 5 man daw ito 0.5 na dito yung nalimot lang ko og show ninyo na ay less than 0.5 man na siya if no need na for antibiotic or i-discourage si patient mag-use of antibiotic or highly need of antibiotic. So muna siya ang procalcitonin. And then remember lang guys the some examples of restricted antibiotic which belongs to our department or pharmacy katong piperacillin tazobactam, cefepime, sa patong lain ertapenem, imipenem cilastamin, meropenem, vancomycin, linezolid na naman taan na kaming amphotericin B. Isa po na siya. Si amphotericin B, asa man na siya makitaan. Storage niya. Storage condition. So, belongs to refrigeration na siya. And then, under monitored antibiotics that belongs to our pharmacy. Nga na ay example. Ceftriaxone, cefotaxime, ceftazidime, ampicillin sulbactam, amoxicillin clavulanic acid, which is coamoxiclav. What else? ampicillin, sulbactam, amikacide, levofloxacin, moxifloxacin, and ceprafloxacin. So for permitted are the following: ampicillin, amoxicillin, oxacillin, flocloxacillin, cefasolin ata, but wala tayo stock siguro. Cefoxitin, cefuroxime, Cotri, clindamycin, metronidazole, rifampicin, erythromycin, clarithromycin, azithromycin, tetraglycin, doxycycline, afloxacin, norfloxacin na, tayo na before, but since wala na siya na-move, so manang gi-phase out na siya sa ato pharmacy, wala na siya. So gang, unsay questions ninyo gang? Na may questions gang? Hello? Hello? Na may
Wala
mga
ra so
questions?
far, ma'am.
Wala. Sure mo, nakasabot. Nakasabot mo or wala? Basin mo kasabot na ako ha.
Unsa gani tong kuan, ma'am? Mnemonic sa bactericidal ug sa bacteriostatic.
Sige, sige. Anita, bakta. Na, andari. Andari ito ha. Asa to? Here. Na, kani. I-familiarize kani ninyo. Tara. So, si bactericidal bang Q RIP. So, beta-lactams, aminoglycosides, nitroimidazoles, glycopeptides, quinolones, rifampicins, and polymyxin. So, under sa ato under beta-lactams, the example ani is are penicillins and cephalosporins. And then sa aminoglycosides, si amikacin. Then nitroimidazoles, sa example anigang, si metronidazole. How about glycopeptides? Muna siya si vancomycin. So si quinolones, si Probe. Muna siya. And then si bacteriostatic, mnemonic is Miss Cold. Macrolides, sulfonamides, chloramphenicol, oxazolidinones, lincosamides, and tetracycline. So, si macrolides, example here are clarithromycin and clarithromycin. Clarithromycin, dayon si lincosamides, lincomycin, and clindamycin. Tetracyclines and doxycyclines. And then, katong sa sepsis, remember, sa man to? Sepsis, you have to remember if the patient, sa man? So, ito dapat i-remember sa sepsis. Asa naman to? Wait, so next. Asa itong next? Ay, wait, sorry. Tara. So, mani ang assessment if the patient is ill. So, consider ninyo ang temperature niya, infection, sa klase infection, yung mental decline, and extremely ill ba siya. Sorry. Sa pailain gang. Na po may laing question.
Excuse me, ma'am.
Oo.
Wala ako question pero pwedeng maka-screenshot sa part atong ampicillin sulbactam, ma'am.
Sige.
Katong pagbalik kanina nawala ko good connection.
Ampicillin sulbactam. This one gang?
Yes, ma'am.
Sige. Tingnan ko kung mag-screenshot mo kaya ako ang ibalik sa slides. Next slide eh. Okay, next slide.
Yes, ma'am. Thank you, ma'am.
Oo. Wait, sorry. Ano, no?
Yes, ma'am. Thank you, ma'am.
Natingnan ako, mo next pa ko.
Okay, ma'am. Sige, ma'am. Wait sa ako.
Ay, sorry.
Okay. Sorry
Okay
kayo.
na? Okay ra,
Yes.
uy, okay ra yun. Okay ra kayo. Kay di ko sure magud if nagkuan ka ng coincide ra akong pag-report og sa kaning sa screen ba kay basin og loading niya. Sige ra niya ako slack kuan. Press niya. Waday taon mo kakuan. Sorry kayo lang. So
It's
next
okay.
ko.
Yes, ma'am.
Okay.
Next, ma'am. The next, ma'am.
Uy,
Oh,
okay ra gyud. Uy, okay ra gyud kaayo. Okay ra gyud kaayo nga. Uy, okay ra kaayo gyud. Take your time ragang. Kuan ra, sayo na lagi ang atong exam. Kaso nakasabot ra mo na ako, no? Ay, ano na to?
yes, ma'am. Okay na mga at least. Diretso na po screenshot, ma'am.
Sige, ako rin na. Next.
Okay, ma'am. Okay, ma'am. And see.
Unsa? Unsa man? Nakuha ra? Nakuha ra gam?
Yes, ma'am. Ma'am. Proof of success.
Yan, mo na i-end.
Okay, ma'am. Sige,
Napa
ma'am.
may
Thank you,
wala?
ma'am.
Welcome. Napay wala? Happy? Sorry ha. Kay kaning atong sinusitis. Pasaylo agad. Kinsa pa'y wala ka? Napa may questions? Napa niya, dahil ko'y pa-answeran ng evaluation palihog ha? Sorry. Then, si Kevin, possible mga 10 a.m. siya mo lecture. Matag na siya og link. So, okay na mo? Time sa, matag na ko og link. So, wait, I don't know. Sorry. Excuse me. Saan nila ko siya forward copy? Saan siya? Copy nga link niya. So, okay na ta, guys. Na po may concerns or sa man clarifications?
None lang, ma'am.
Wala na. Sige. So, musend lang ko og link. Then, kindly na lang answer the evaluation form, ha? Then, Sir Kevin will report at 10 a.m. later. Sumpay siya sa cabinet nako. So, cabinet 7, antibiotics gihapon. Then, usually, under sa iyaha are monitored antibiotics and controlled antibiotics. Wala siya yung mga restricted. Sige, thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.